mic icon down. You just click on it and you'll be muted. If you require any assistance, please contact us on the chat box. And if there's any fluctuation in your audio video, please check your internet connections. And do not disturb the speaker in between. We'll take up questions at the end. Today is the no tobacco day. So happy no tobacco day. So please say no to tobacco and enjoy life. Today's topic is holistic approach. And our speaker today is Dr. Atul Pednekar. Welcome, Dr. Atul Pednekar. I would request Dr. Neha Solanki to introduce the speaker, please. Dr.
Yes,
Neha?
ma'am. Yes. Namaste.
Yes.
Namaste, everyone. Myself, Dr. Neha Solanki from Surat. Dr. Pankaj Lakhani के through इस group में मैं join हुई हूँ. So thank you all doctors of this team. As today our government has declared unlock. So हम सब भी कहीं ना कहीं आज अनलॉक कर रहे हैं बहुत सारी चीजों को. एंड Dr. Atul Pednekar, our speaker, is a great personality. He is a homeopathic physician with psychotherapist and the yoga consultant at world's oldest institute, Yoga Institute, the Yoga Institute Santa Cruz. I think the persons or doctors who are in field of yoga, they know the Yoga Institute Santa Cruz. It's a very, very positive institute, and Atul sir is has given service since 25 years as a senior faculty at the Yoga Institute Santa Cruz, Mumbai. अतुल सर ने आयुष मंत्रालय से भी जुड़े हुए हैं एज अ सीनियर रिसर्चर. 2 बुक्स के वो ऑथर भी है, मेंडिंग द माइंड एंड इंटीग्रल चक्र साइकोलॉजी. स्वाध्याय is a very interesting topic in which Atul sir is dealing presently. Swadhyaya is self-analysis. So thousands of students has trained with Atul sir in field of yoga, and in homeopathy also he is working fabulously. So योग इंस्टीट्यूट से एक बात मैं भी सीखी हूँ, हम कितने भी अच्छे डॉक्टर है, कितने भी अच्छे टीचर है, कोई भी फील्ड में, कोई भी प्रोफेशन में हम कितने भी अच्छे हो, उससे पहले जरूरी है कि हम कितने अच्छे ह्यूमन हैं. So the 100%, if we count 100%, then to 70% is what we are as a human, and the only 30% role is that what skills we have, in which profession we are, is its role is only 30%. So Atul sir is a very dynamic personality. As a top team, he had a very busy schedule, and still he gave us time. So thank you so much, sir, for giving your time and knowledge to all the doctors. Thank you so much. I will say one prayer. So please, everyone, join your hand in Namaste. Close your eyes. Let's pray to God. Let's our journey begin from darkness to light. ऐसे तुमा सदगमय तमसोमा ज्योतिर्गमय मृत्युर्मा गमय. ओम शांति शांति शांति. Thank you, God, for everything, and let's hope we all learn best from Atul sir. Thank you, sir. And I request Dr. Yogesh to please introduce something more about Atul sir, because Atul sir and Yogesh sir, I just today morning I came to know that both are classmates. So, Dr. Yogesh, please continue.
Okay, thank you, Neha. Thank you so much. And I welcome you all to the 52nd continuous medical education, 53rd. And Atul being my classmate, I'm so glad actually to see him here. In fact, I was so excited. I told my entire homeopathy classmates, that all of you should be present. Atul is coming here. And I'm very fond of him. He went into spirituality 10 years before me. 25 years, I went up to 15 years. I can just recall one amazing incident, which I think you should try. And that was given to me by Atul. Um, Atul was practicing Mona. Mona is where you do not speak. And, he told me something, Pankaj, you'll really like it. You can try it. And we used to drive two-wheelers then. And he told me that, Yogesh, try to ride a two-wheeler without honking for 21 days. Now, in the city of Mumbai, more than a life partner on a two-wheeler, you need is a horn and a brake. These are two very vital things. Third is the life partner. So I said, okay, let me try it. And I did it. It was so tough. It was so tough. But what really happened is I met Atul after some time and I said, you know what? I've become very slowed down. I've become very quiet. And, rather than getting angry on others, I'm just taking care because I can't honk, so I can't go fast. So suddenly my riding skills improved. I became more quieter. I became more tolerant. And that's what he said was the inner mourn or the inner silence. That's exactly what homeopathy teaches us. Aphorism number 6. To be unprejudiced. What is that? Our inner prejudices which we have. A patient is talking about thirstlessness, crying, and says, I'm changeable. Immediately we are thinking of pulsatile in our mind. But Hahnemann tells us even not to have that. You be mourn in your mind even that time. Till the end of the case, be there without a medicine. And finally, then once you have completed the case, then you start using all your analysis. And this I learned from Atul in a very simple way by telling me not to honk the bike while you're riding. Such a simple thing. And Atul is that. Atul, Atul, I'm allowed to call you Atul, right? He's my classmate. He's my bum chum. And he's a very simple person. He's a very simple person. You will see it in his presentation, in his talking. He's a great friend, amazing carom player. He's a superb singer. And of course, a very great exponent of yoga. So I won't take much time from you, Atul. Over to you, Atul. And yes, make the best out of this man. He's got a lot of hidden treasures. And he will give it to you in a very, very beautiful, simple, easy way. Just be patient. You can't hurry him. You got to slow down. So if he doesn't match with your pace, you have to reduce. Like, there's a joke they say, if you didn't understand my joke, then let me know. And then when people say, okay, we didn't understand the joke. So he says, if you don't understand my joke, then you raise your standard. Same way, if you want to understand Dr. Atul Pednekar, you got to slow down, come to his pace, match his pace, and then you see what really gift you will get from him. And thank you so much, Atul. We are all waiting, including me, to see what you really have to offer to us. He's working at the world's best yoga institute, which is 100 years old. And as Neha rightly said, you must visit once. It's beautiful. If not for yoga, the food is awesome. Believe me, I go there only for food. Over to you, Atul.
Yogesh, thank you so much. Before Dr. Atul starts, I just want to remind everyone that today is one of the biggest feast of the whole world. It is called the Feast of the Pentecost, which is the day where the healing starts, the Feast of the Holy Spirit. Today, if you read the books, it says God is everywhere. And the God is everywhere word came from the word of the Holy Spirit, because Holy Spirit is everywhere. And today we are in the world of the Holy Spirit at the beginning, and this is what is the Spirit, which we'll be seeing in Dr. Atul Pednekar. Over to you, Dr. Atul.
Thank you everyone for a kind word. So first of all, I would like to thank Dr. Neha Basically, we were supposed to have a session for her group, which included not only doctors but common lay people also. So we thought of taking up the topic of holistic healing, where I could describe more about yoga. But then later on, she told me that there is another vibrant group which is more into homeopathy, and they are also dealing with various topics. And that is how it was shifted over here. But suddenly I found myself in a fix. Basically, I was preparing my talk entirely for lay people, and then suddenly I had to shift to more of homeopathy. But then I believe I will be able to do a justice. Yogesh, as a very, very good friend, has praised me a lot, so put more pressure on me also. So I believe he will also be one, you can say, instrument over here to ask the right questions in between, so that I also remain on track and try to give the best of whatever is available for me. I also thank Dr. Pankaj, who in between we had a talk, and then he explained me the entire process as to how this talk would be. So thank you, Dr. Pankaj. Thank you, Dr. Neha. And Yogesh, no doubt, first of all, a very, very good friend, a very, very good football player, a very excellent speaker. So if I have some knowledge, most of my teaching skills, I've learned it from him also, how to keep the audience live. I keep on inviting him to the Yoga Institute for my various programs. And believe me, the students also love him. The way he basically inspires people, the way he basically motivates them to bring the best out of them. So trying to sort of motivate me also here. Thank you, Yogesh. And thank you, Dr. John, for the beautiful introduction over here. Dr. Deepa also for starting with this program. So I think let us all begin with the session. So just a minute, please. Okay, so as you all know, the topic for today is holistic approach. So just trying to brief over here as to what holistic would mean. Luckily for me, I started my journey with homeopathy, which helped me understand a person from a very totally different approach, I would say. Again, fortunately, after that, after completing the course, I was involved with lots of doctors in something called as drug proving. All of you are aware about drug proving, and the drug proving also helped me understand more about the elements from which these drugs are made, and then how basically we start becoming that. So very difficult to explain, but somewhere down the line it makes you feel like that particular drug, which is a different kind of an experience. It was a beautiful experience. So from homeopathy, my journey into yoga was also quite interesting. One day during one of the drug proving sessions, one of our friend happened to mention that yoga has over 100,000 asanas. So there are different asanas which are related to, suppose, animals, mountains, so aspects of nature, etc. And the discussion went on to saying that, okay, it's so nice, there are so many asanas. So if we know that a particular person relates with a particular personality, then wouldn't it be easy then rather than giving a medicine to that person, we can just give them an asana? So that was a wonderful concept for me, that I don't have to now stock medicines. I will not be limited by the number of medicines that I hold. No problem with the potencies. I have to just learn the asanas. So once I learn the asana, I know the different kinds of asanas, and instead of giving the medicine, I can just give them an asana and the cure would be complete. And with that intention, I happened to join the Yoga Institute, which is just at Santa Cruz. So that was another lucky thing for me. I stay at Santa Cruz, and within just 10-15 minutes walk from my home, the Yoga Institute was placed. So I happened to join over there. But that is where my eyes opened And I understood that yoga is not about asanas. Asanas and pranayams are just, you can say, not even 1% of asana of the yoga aspect. So if you have heard about the Patanjali Yoga Sutras, we find that out of the 195 asanas, sorry, the sutras that are mentioned over here, sutras, if you can understand, very similar to the aphorisms what we see in Organon. So there are brief sentences with a lot of meaning. So out of the entire Yoga Sutras, only 7 sutras relate with asanas and pranayama, whereas the rest of the sutras mention only about the mind. What is the mind, how the mind functions, how the problems occur with the mind, etc., and how to basically handle the mind, overcome the difficulties of the mind. Now, being a homeopathic doctor, I could see the similarities, and therefore my interest in yoga also started increasing. Now, basically, I'm more into the yoga psychology part, but being a homeopath, I could see, or it allowed me, or I would say I was privileged enough to be introduced to homeopathy first, which helped me understand the correlation between healing, mind, body, etc. So this is going to be a small attempt from me to try and put in my experiences, whatever I have understood through the integration of yoga and homeopathy.
कैमरा चालू करना है,
So,
कैमरा भी चालू करना है.
so that I can bring about this concept of holistic approach. So first,
Dr. Atul sir, please unmute your mic.
He's already unmuted.
Okay.
Dr. Atul.
Okay, sir.
can you hear me?
Yes, sir.
Okay. Okay. So as I was just saying, I would like to share my experiences with yoga and homeopathy. How basically homeopathy helped me understand yoga. At the same time, yoga helped me understand homeopathy better. So that is what I will be trying to explain over here. So first of all, when we begin with the topic as the holistic healing, now if you can see, the word healing is also seen to consider or contain restoring the whole. So if you understand, the health is seen as a wholeness, and therefore whenever we lose this wholeness, that is considered to be the disease. So healing would be considered as restoring this wholeness. So from this perspective, therefore, is it that the word holistic healing itself is a misnomer, because healing itself is about restoring the whole. So when we talk in terms of healing or the whole, we always consider that to be an aspect of physical, mental, and social, spiritual health. So the wholeness is already included in the word healing. So if we see holistic healing, is it a misnomer? If you want, you can take it. If not, it's okay for the moment. If you just choose to use the word as holistic healing, even that's fine. But now to understand it, let me take you to another story. Most of you must be knowing about it. But for those who are not aware of the story, in brief, I'll just mention this. So there is a story about 6 blind men who have never seen an elephant. Okay, so they wanted to understand an elephant, and they kept on imagining about it in various ways. So one day, one person from the village did one simple thing. He put the elephant in front of them and asked them to touch it, feel it, so that they have an experience as to what an elephant is. So now what happens is, these 6 people go and touch the elephant at different parts, and then accordingly they come to their own conclusions as to what the elephant would be like. So one person goes and touches the tusks and says, oh yes, I've got it, the elephant is like a spear. The another one goes and touches the trunk and says, oh, I got it, it is like a huge snake. Another one touches the legs and says, no, 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 the elephant is like a pillar. Another one touches the flanks and says, no, the elephant is like a wall. And the 6th one goes and touches the tail and says, no, it is like a rope. And now they have a fight with each other as to what the elephant would be like. And then finally, in some way or the other, their blindness is removed and they see that the elephant is neither of it. It's a totally integrated, or you can say an complete picture is totally different, which is an addition of whatever they all felt. Now, this story is actually used as a metaphor in Indian spirituality, where we try to understand something in its totality. So if there is something called as a truth, is it that basically that we are aware of that truth, or are we aware of only parts of that truth? And whatever we experience, therefore we consider it to be the entire truth. So now similarly, coming back to an unfortunate event, some of you might be aware about this, maybe 1 or 2 weeks back, we had basically uh, a small advertisement posted by the ICMR, Indian Council of Medical Research, which is a department of the Institute of Health, basically, Government of India, where they put an advertisement for a post, and in that they put it as two categories, one as medical and one as non-medical. So in the medical, they put it as basically the MBBS doctors, and then in the non-medical, they put as the BMS and the BHMS, the homeopaths and the Ayurvedacharyas in the non-medical. Now, the intention of this is not to basically say anything about the allopathic doctors, because I am sure there are lots of homeopathic or allopathic doctors also who believe in homeopathy, yoga, etc. So let us not consider this as a general statement of all allopathic doctors, but can we see over here a perspective within each one of us to consider ourselves only as the entire truth? And would that apply even to homeopaths? So can we understand holistic from a different perspective, and rather than considering homeopathy as a holistic science or even yoga as a holistic science, can we see even yoga, homeopathy, allopathy, Ayurveda, etc., all these sciences as a part of a holistic field called healing? So the healing is an entire universe by itself, and within that there are different sciences which are trying to put forward their own perspectives, and then we as a doctor can stand by our own field also, but at the same time that we are a part of the whole and not necessarily the whole by ourselves. So with this intention, I would like to go forward with my talk today. So when we talk in terms of holistic healing, again, as I said, the holistic word, it's up to you. You can choose to keep that. But from one perspective, the word healing itself includes the term holistic. So what would that holistic healing mean, or what would that holistic term would mean, and how can we achieve it, or what is it that could be stopping us from achieving it? Now, I'll try to portray it from two perspectives from whatever I've learned. So from yoga, whatever I've understood from a perspective of koshas, and then secondly from the perspective of homeopathy, and then again how I related with yoga. So first, when we relate with koshas, so what do we mean by kosha? Koshas, basically, you can see the another word for that in English is seen as a sheet or a layer. And this, according to the Vedantic philosophy, is an expression of our existence, how we exist. So we see ourselves just as one thing, but according to the Vedantic philosophy, we are made up of different layers. These layers what are called as koshas, and they are all within us. So to understand it, the 5 koshas, the inner one or the basic one is what is called as the Anandamaya kosha or the bliss body. This is basically the phase of bliss. Then outside that is something called as the Vijnanamaya or the Buddhimaya kosha, also seen as the wisdom or the intellect. This is the intellect part of us. Now again, there is a difference, slight difference between intellect and wisdom. Intellect is more about how you just rationalize or analyze the data. Wisdom is how you use that data. Now you can see that as separate, or you can see that as a part of your intellect also. Second thing or the third thing is the Manomaya kosha or the emotional body. So the emotions and the intellect together will form the mind, but over here they would be seen slightly different. Then we have the pranamaya kosha, or the energy sheath, and lastly we have the physical body, or the annamaya kosha. So the annamaya kosha is the one that is one which is derived from the food that we eat. So anna relates with the food. So that part of us which is derived or nourished by the food that we eat, and therefore the physical body, the tangible body that we see, that will be the annamaya kosha. Okay. So now if we see, we are all existing in these different planes. At the same time, can we also see that disease can also be seen as existing at these different planes? And similarly, therefore, even the healing modalities relate with different planes. So to give a simple example, can we relate the annamaya kosha, or the physical body, with the allopathic stream, which deals with more of the physical elements or the tangible elements? Nothing right or wrong about it. It has its own importance. For example, our understanding of the body, the anatomy, physiology, comes more from the studies at the allopathic level. Okay, so that also is true, that is also necessary. Then the pranamaya kosha, the energy sheet. Over here, basically, we have the different healing modalities, or in a sense, in yoga, we call it as the prana. In homeopathy, we call it as the vital force. In Chinese philosophy, we call it the chi force. So chi energy. So this is the energy body, or different words for the energy body. So the homeopathy, which works more at a energy level, and from here it can affect the different other levels also. Then pranayams in yoga, again over here, or some of us who would be maybe Reiki healers, energy healers. So they all work at the level of the pranamaya kosha. Then we have the manomaya kosha, which deals with the emotions. And then we have healing modalities which work at the emotional level. So if you are aware, there is something called as, you can say, emotional freedom technique, or NLP, or to some aspects of yoga also, hypnotherapy also. They try to work on the emotions and try to balance that out. Or similarly, the Vijnanamaya Kosha, which deals with more the rational part of us, the intellect part of us, the counseling which occurs more at a wisdom level. So similarly over here, every healing technique can work at all levels. So if you see hypnotherapy, it deals not only with the emotional body, but it also brings in some aspect of rationality within us. Yoga philosophy, or various philosophies, spiritual philosophies also try to bring out the wisdom part in us, and therefore bring about some kind of a healing. And therefore, lastly, the Anandamaya Kosha, or the bliss body. Now, the Anandamaya Kosha can be seen from two perspectives. One, basically the causal body. Sorry. So, from one perspective, the Anandamaya Kosha is seen as the causal body, or the prime source from which everything springs forth. So, it's like in Anandamaya Kosh, we are just in a state of bliss. There are no thoughts, no emotions, no body or anything. But as the creation occurs, according to yoga and the Indian philosophy, it is the rational part of the thoughts over here that first occur. So the first creation occurs at the level of thoughts, and then from the thoughts, slowly the emotions start getting affected, and then slowly the energy and the physical body starts getting formed. So whether you believe in it or not, that's another thing. But just if we see from a perspective of homeopathy also, how we see that the mind also is quite important when we talk in terms of a disease. Keeping the mind in balance is also very much important. If we correct the mind, then the disease can be eliminated at a very deeper level. Okay, so that is one thing. So first, as I said, the Anandamaya can be considered as a causal body, or secondly, it can also be seen just as an experience of complete health. So when we talk of that wholeness, when we talk about that healing which has occurred, restoring that wholeness, can it be seen as an experience as an experience of complete happiness, complete health. And when we reach the Anandamaya Kosha, the Anandamaya Kosha would be related with that experience. Okay, so depends on you how you look at it. If you are not too much interested in spirituality, you may eliminate this. If you believe in spirituality or the philosophical aspects, you can see the Anandamaya Kosha as a causal body. If you do not believe so much in this, you can see the Anandamaya Kosha as an experience of bliss, or at our layman terms, we call as happiness. So the experience of happiness or complete balance, which comes from an experience of complete health at all levels. So physical, mental, social, spiritual, when there is a balance at all the levels, then we will be experience that complete health. Maybe we can see that as when we reach the Anandamaya Kosha. Now similarly, if we see these koshas, they are not different or they are not distinct as such. There is a connection between each one of them. Okay, so for the moment I've kept the Anandamaya Kosha out of this, because Anandamaya Kosha, I'm taking it just as an experience of health. So if I want to reach that health, can we see that I can achieve my health or my state of balance from any of these levels? So for example, when we talk in terms of the Annamaya Kosha, as we said, this relates with the food that we eat. Is it not that sometimes when we have a very good food, we experience some sort of a happiness? So sometimes food gives us happiness, or physical things also give us happiness. Wearing some nice cloth, or basically having a physical tangible thing in your hands, maybe a good mobile phone, or you giving a phone to your son or a daughter, your child, and they feeling happy. So can we see some of our happiness is also dependent on the physical aspects? So similarly over here, can we see that health from a physical aspect, like when we talk in terms of the allopathic medicines? So allopathic medicines, whether we completely believe in that or not, but even they can contribute to a state of health. From a homeopathic perspective, we will say that yes, it is temporary, but it is possible. Okay. Now, along with that, next is the pranamaya kosha. So the prana, or basically the energy sheath. So whenever we are healthy, or basically something happens when we feel energetic, do we feel happy? Something happening, you get up in the morning, you are refreshed, your energy levels are high. Do we feel good? Do we feel happy? Do we feel a bit more healthy? So can we see that healing can occur at a pranamaya level also? So those who might be practicing or who have experienced something called as acupressure, acupuncture, energy healing, aura healing, chakra healing, have you experienced a kind of a balance within you? And if that happens, then can we say that even the prana can contribute, or the pranamaya kosha, balance of the pranamaya kosha can contribute towards our experience of health also? Similarly, the monomaya, when our emotions are balanced, do we feel good? Or in a sense, what we simply call as the positive and the negative emotions. So how they also contribute towards our sense of happiness. And then lastly, the buddhimaya, good thoughts. How do good thoughts make us feel? So if good thoughts are there, automatically do our emotions become good, and therefore we start feeling good or happy. Now, is it individualistic, or again, are there connections between each one of them? So now let us take a simple example. Most of us would have had a sprain sometime in our life. Yes. So while walking, suddenly you fall down, you get an injury or you get a sprain. So whenever we get a sprain, can we see that it has begun at a physical level? It is the Annamaya Kosha, the physical body, which has got affected. So when the physical body has been affected, we start feeling the pain. But when the pain starts becoming severe, what happens to our level of energy? Does our energy start feeling low? Now suppose just at that time, suppose remember when you were small, you were playing, you fell down, you came back home tired. or now that you are married, now this will apply mostly to the males, if not to the females also. Sometimes you have a sprain, you come back home, suddenly you feel a loss of energy, and then suppose for a female it could be her cooking time, or for a male it could be just as resting time, because usually males nowadays basically males have started working in the house also, but otherwise the males would try to do more of intellectual work rather than the household work. You can take it as a joke if you are sensitive about it. So over here, when basically the pain is there, how do we find our energy? If your spouse asks you to do a job at that moment, what would be the usual exercise? What would we say? Wouldn't we usually say, "Arey, I'm too much tired. Basically, I've got this pain. Please don't tell me anything right now. I don't have the energy to do that." So can we see when our physical body is in pain or is in some kind of an imbalance, our energy also starts falling down. Now suppose your spouse, or suppose when you are small, your parents keep on being after you and just ask you to go ahead and just do that job. I know your leg has been spread, your ankle has sprained, but your hands are free, no? So you can do it with your hands also. You can sit down and do that job. Now don't give me any excuses. So when somebody keeps on pestering you, what happens to our emotions? Do our emotions get disturbed? And if our emotions are getting disturbed, wouldn't it mean that basically, even though it started at an annamaya kosha, it can also affect our manomaya kosha? And when my manomaya kosha has been affected, what happens to our level of rationality? Are we rational, or do we start become illogical? Are we able to control our emotions? And when our emotions are not in our control, do we start reacting rather than responding? I suppose you understand the difference between a reaction and a response. A reaction is, in a sense, an immediate, like a spring, like knee-jerk reaction to something, which does not involve too much of a thought, which has too much of emotions, and then usually this is something. The reactions are something that we usually sort of repent later on. As against that, a response is a more thoughtful process which needs our mind to be calm, so that we can think or analyze that situation in a better way and give a response that is more beneficial for us. Now, can we see that all of this came out from a simple pain in our body? So even if it is from the body, can we see that it is going to affect each and every aspect of us? Now, if I take a simple painkiller, if the pain goes away, for that moment when the pain goes away, does my energy come up? Do my emotions get balanced? Do I become more rational? So can we see from homeopathic perspective, again I'm repeating, we may see it as a temporary thing, but can we see that even the annamaya kosha can cause a balance in the other levels? Now, suppose, now think of a child, because right now, or okay, you can think as an adult also. Now suppose you were having this severe pain, you're feeling the lack of energy. Now just consider that presently there is no lockdown, so you're free to move around outside also, anywhere as such. So suddenly you get a message on your phone, on your college group, that you are having a get together or maybe a party tonight. Now suddenly what happens? What happens to your pain? Can we see that suddenly the pain is gone? Now where did the pain go away from? Did something happen where basically my emotions changed, my focus changed, and when my focus changed, my emotions became happy, and when my emotions changed, I became more happy. Suddenly do I find myself more energetic? Do I find myself getting more logical? Now that my emotions are balanced, do I see myself becoming more rational and try to speak with my wife in a more rational way rather than reacting to her? Because now I understand that reacting is not going to help me. I have to become rational so that I can have my way and get the permission from my wife so that I can go for the party whenever it would be, maybe tonight or tomorrow morning, whenever it is. So can we see the rationality coming in up immediately? And the pain has disappeared. I've not taken any tablet, but I don't feel the pain. I suppose all of you must have experienced this. The examples could be different, the situations could be different. But can we see that, in a sense, how just one level can cause a balance in the others also? Similarly, it could be just a simple meditation that you're doing, a simple pranayam that you're doing regularly. It just calms you down. And when you have just calmed yourself, does it happen that your emotions start getting calmed down? Your mind becomes more rational, the physical symptoms go on disappearing. So can we see that whenever we are trying to heal ourselves, the healing can be done from any aspect. So there is nothing right or wrong about it. Healing can be done from any aspect over here, depending on, in a sense, what is available to me also. At the same time, it also depends, we may say, okay, so one more thing over here when we, yeah. So as I said, there are different healing modalities which are related to different levels, different koshas, and each technique or each method has its own advantage. So for example, there was a question that was, because when I passed out with homeopathy, certainly I had a lot of faith in homeopathy. And then it was like, no, there is nothing else other than homeopathy. And then one of my good friend, he just asked me a simple question that, okay, God forbid it, but suppose there is somebody in your family who's very near and dear to you, and suppose that person has a severe heart attack, what will you do? Will you give him homeopathy or will you take him to a doctor and get the ECG and the other investigations done? And that question sort of, in a sense, bolted me. I said, yes, in a sense, at that moment, what would happen to my faith in homeopathy? Now, again, I do not say that homeopathy is not applicable in these conditions also. I'm not absolutely saying that. There are possibilities over here also, but can we see there are different states of our own mind also? And in different states of mind, would I be able, because what happens is the Annamaya kosha is more tangible, it is more measurable. And therefore, in a sense, therefore, it is more fixed as such. But as against that, the other fields, the pranamaya kosha, the manomaya kosha, or the buddhimaya kosha, these are sort of intangible. They are slightly or unmeasurable, which is why there are some chances of some errors over here also. As against that, suppose over here, if we say, we all know that in allopathy, we would say, okay, this problem, give this medicine, this much dosage, and repeat the dose after 6 hours or 8 hours or 10 hours. So there is some fixity over here because there is something which is tangible and measurable. But over here, because it is intangible, it also creates a doubt in us. And because of that doubt, or doubt can be seen as a lack of faith also, it may not allow us to completely surrender ourselves to that remedy. If I, as a homeopathic doctor, could feel that at that moment, but that was quite early in my practice, this moment also sometimes we may be feeling this. If I, as a doctor, can feel this, now consider it for a patient. Would a patient be completely able to keep that faith? Sometimes our patients do have complete faith in us also. But I, as a doctor, have to take a decision over here. Should I be taking that risk or not? So again, over here, there is something called as complementary medicines. So as acute, certainly we can give them allopathic medicines, but then slowly, is it possible that I can sort of wean them out and convert it into a homeopathic or a yoga or any other form of therapy as such? So similarly, if basically a patient comes to you with diabetes or hypertension, now this suggestion I keep on giving to my students at the Yoga Institute also. There are teacher training students at the Yoga Institute. This applies even to homeopaths as such. But most of you are quite senior doctors, depends on what your individual experience would be as such also. But if you have complete faith, if you have basically excellent results, you can certainly go on ahead with it. But suppose you have a patient with hypertension and the person is already on medication. Now, if you start with the allopathic medicines, are you immediately going to stop with the allopathic medicines? Because if you stop the allopathic medicines, the pressure is going to shoot up. Are you sure that your homeopathic medicine is going to reduce the blood pressure in 1 day, 2 day as such, and then bring it under a normal level, and therefore in a sense the patient would be safe? If suppose you are giving the medication, the homeopathic medication treatment, and you find if you have stopped the allopathic medicine, some of us do that also, we do take the test regularly, we keep on checking the blood pressure, and we find suppose that the blood pressure is not reducing, the blood pressure is still quite high. What would you do? Would you basically continue only with the allopathic medicines, or allow them to continue with the allopathic medicines, and then slowly as the homeopathic medicine starts acting, would you basically go on slowly tapering down the allopathic dosages? Because I've seen this with yoga, especially when the person starts practicing yoga, because there would be some yoga teachers or gurus who would say, okay, stop all the medicines immediately and just do this Kapalabhati or do this exercise. Would it be good from that part or not? Can it be harmful if the pressure remains high, if the blood sugar remains high? Would it be causing the internal damage? Because we know that continuous high blood pressure or continuous high blood sugars, they are causing internal damages. So would you allow that to happen, or are you sure that basically homeopathy would be able to take care of that, maybe for 1 year or 2 years? And if even if without the allopathic medicines, the blood pressure or the blood sugar remains high for maybe 2-3 years or so, would it be good enough or not for the patient, or would it be risky for the patient? So this is something that we need to understand over here. And then let us not get too much fanatic about the treatments that we are doing. Let us accept that basically every system has its own limitation, or maybe I as a healer myself may have my own limitation. The limitation may not be in homeopathy, but the limitation could be in me as a healer, where I have not been able to find the perfect simillimum. And if I have not been able to find the perfect simillimum, should I put the patient at risk for my own errors? And in that sense, therefore, would it be necessary to continue with the other medicines, whatever the patient has been taking? So now, just coming back to it, if we see, normally we understand medicine as aspect of anatomy, physiology. So physiology, for some of you who are, maybe there's some lay people also. So physiology we see as a study of the normal functioning of the body, and then pathology we see as the study of the abnormal functioning of the body. Now can we see that anatomy and physiology, the knowledge of anatomy and physiology remains almost the same for most of us, but the concept of pathology changes with every kind of a therapy. What is the cause of a disease? What is the cause of a pathology? Why disease occurs? There are different beliefs regarding this. So homeopathy has a different concept of disease. We see that as a part of the miasms. Then Ayurveda would see it as basically the three doshas. So in a sense, so you can say the sattva, rajas, tamas, etc., an imbalance within that, and that is how it is experienced as a disease. In allopathy, it would be seen as a material cause, a chemical, or so you can say an antigen or an anti. You can say the viruses, bacteria, etc. So they are considered as to be the cause of the pathology. So can we see every therapy has a different concept of a pathology, but at the same time, every philosophy is true in its own ways. So coming from this concept of a pathology, there would be different therapies. There are different therapies depending on different concepts of pathology. So there are different therapies. We can certainly follow any one therapy according to us, but let us understand that as much as allopathy has its own limitations, similarly yoga or any other therapy that we are following, even that can have its own limitations. So to give a therapy, first of all, we need to understand the disease. So my therapy will be dependent on my understanding of the disease. At the same time, I need to understand the patient also. Often, the patients are also related, or in a sense, they have their own sensitivities regarding the different koshas. For example, there would be so many patients who would not believe in, suppose, homeopathy, or basically the pills that are being given, and they say, oh, this is basically something absolutely not useful. These are just sugar pills, nothing into it. Now, maybe to satisfy that patient, even though they have come to you, is it possible that we give them something at a physical level also? So maybe you call it a biochemical medicine, you call it a placebo or whatever it is. But is it something that I can give them just as a tonic so that the patient feels better? If you see that in yoga especially, or any other form, there would be a counseling, suppose. All patients are not necessarily open for counseling. Now, what do we do with them? So if I tell them, because counseling is about making them understand what is their role in the problem. So patients sometimes find it very difficult to see or point the finger at themselves and work on themselves. So as of now, I have, after my experience in counseling, most of my patients, I have been able to shift them towards yoga and counseling. Even those who come to me for their homeopathic treatment, if they have faith in me, I shift them towards yoga or counseling. And then when I work on them through the mind level, I see a lot of difference in them also. But then there are some relatives of my patients or my students who come down and they say, sir, basically I want them to undergo counseling, but they are not ready for counseling. Now what do? I say, good enough, no problem, bring them down. You bring them to me as a homeopathic doctor. So let me say I'm giving them a homeopathic medicine. So the benefit for me is the homeopathic case taking is almost 90% job done for my counseling. It's almost the same. So if I take the homeopathic case, I've already done 90% of my exploration as a counselor. And then later on, the 10% part of it, I can just counsel them also, or I can make them understand their own responsibilities in the problems. And if not, I can still give them a medicine. Often it would be a placebo. But because I've counseled them, or I've just basically directed them through some aspect of a counseling, often there is no need for the medication. So even a placebo would work. Now, I would also like to recall one particular sentence from one of my great teachers, Dr. Shankaran. You all know him. So he would also go in this kind of a deep case taking. And then from there, basically he had mentioned once, I still remember it very vividly. He said that if you have really taken a proper case, you have really understood the patient, you need not give him the medicine. Just that understanding the patient, what the problem is at an emotional level, that itself often helps the patient. So at an understanding level, as a doctor, you know what medicine is necessary for that patient. But even if you don't give that medicine, if you just derive that medicine in your mind, but if the patient feels understood, then more often than that, you will not need to give that medicine. And I've tried it that way also. So often when I felt that, okay, the patient felt understood, we have just given the placebo to the patient and the patient has recovered quite well. Okay, so I need to understand what the sensitivities of the patient is. So if the patient wants more of a physical thing, so in a sense, suppose, especially when people come to yoga, so there would be some patients who want only asanas. So if they want asanas, they will not be basically more suitable, or in a sense, they will not be patient when we give them meditations or pranayams. They want to do the movements. They want to do the, you can say, the power yoga, the fast movements. So there are some patients who work more at a physical level, the Annamaya Kosha. They want more bodily movements. They want more gross medicines. A small powder is not enough for them. And then for these patients, initially to win their faith or win or make them more comfortable as such, you need to handle them at an Annamaya level. Even though as a doctor, I understand that basically they need work more at an emotional or an manomaya or a buddhimaya level, you still have to work on their body level. You have to give them the asanas, make them move their bodies more vigorously. But then slowly as they do that, they start becoming calmer. And then they are able to come down to the level of meditation. So there is one more experience that we see with yoga students, that when they join the yoga institute, or when they other teachers also, when they come down for yoga, the most difficult thing for them to do is meditation. You ask them to sit down and close their eyes, they're just not able to do that. They get so much restless. Every other second they keep on opening their eyes, looking at each other, what the other people are doing, and you keep on giving the instructions, close your eyes, calm down, just focus on your breath. And then you will find maybe 5 6 people in that entire group of maybe 20 30 students who are constantly basically opening their eyes, just moving their bodies, shrugging their shoulders, turning and twisting in spite of the instructions that you are supposed to stay quiet. Now, these are the patients or these are the students who are working more at basically the Annamaya level. You have to address them at the body level. So, can we give them simple asana or at a yoga level? We give them more asanas, dynamic movements. So, okay, keep on doing the movements, because in a sense, if you're doing an asana, even that asana involves a meditation, because when you're moving your body, your awareness is on the movements of the body parts. So in a way, that is, you can say, a meditation in movement. And then slowly when they keep on doing the asanas, they are slowly able to calm themselves down, and then maybe after a week or two they would be able to do a better meditation. Okay, but at the same time, I'm not taking away the aspect of the doctor himself, the physician himself. So if you have complete faith in what you are doing, understand your expertise. If whichever field that you are practicing, whether it is yoga, whether it is homeopathy, any aspect of homeopathy, whether it is a biochemic, whether it is back flowers, it is the constitutional or miasmatic, whatever it is, if you are quite sure about it, then believe me, if you have faith in yourself, then the patient will have faith in yourself also. So, in a sense, I'm not saying that everything depends on the patient and the disease only. It is basically, you can say, a proportion over here. Something depends on the outside factors also. It depends on the disease. It depends on the patient. But it also depends on you. If you have complete faith in yourself, I know of doctors who have given, in a sense, somebody from a group also, or otherwise also, we keep on getting these cases being mentioned in different papers as such, where we find doctors giving medicines in cases of myocardial infarcts also, and in a sense taking their ECGs and everything, but not giving any other dilators or anything, but sorbitol or anything else, but simply giving them homeopathic medicines and being able to bring the patients out of that. So if you have that faith, okay, certainly you are the master, you go ahead with that. But if you lack your faith in yourself, then I think you also need to give some credence to the disease or the patient also. So from this perspective, this is one perspective which I see from a perspective of kosha, how we need to understand the importance of all the different areas as such, and not get too much involved or dependent on only one field. So as we know, as it is mentioned in the aphorisms, I call it the homeopathic sutras, the high and only mission of the physician is to restore the sick to health, to cure as it is termed. Now, as much as initially this was supposed to deal with the allopathic doctors who were against the homeopathic field, and they used to sort of put it down in lots of ways, but can be also related to ourselves, that in a sense right now, whatever am I doing, whichever kind of a treatment that I'm giving within homeopathy. So within homeopathy also, now we have got so many sub varieties. We have the Vijayakaran style, we have Shankaran style, we have Sehgal style. So can we understand each style over here has its own credence, and Again, therefore, in a sense, its own advantages as its own disadvantages also. So my job over here is not to basically, in a sense, think of more of the philosophy of just because over here when this was mentioned that the job of a physician is not to basically go too much in the philosophy. Whichever philosophy you are using, the final parameter is your patient getting better? If the physician, whichever treatment he or she is giving, if the patient is not feeling better, then my job as a physician will be to question something about myself also and do what is best for the physician, best for the patient as such. Okay. So that elephant is a general, if you see this elephant as a universe, so there are multiple universes around us. Healing in itself is a universe, but at the same time, if we see within that universe of healing, even homeopathy is a universe in itself, and homeopathy would also have its own different bifurcations which have its infinite possibilities. So let us not basically just get fanatic or rigid about any one philosophy or anything. And you are doing a great job over here. This forum is doing a great job by inviting speakers from all fields so that we get exposed to different thoughts and understand the possibilities, the various possibilities within homeopathy also, and understand the limitations of our own thoughts if we get just fixed to one particular philosophy or a principle. Now, from the perspective of homeopathy, what did I learn about homeopathy which helped me understand the concept of holistic medicine? So if we see basically, normally we consider the two things, health and disease. But homeopathy helped me understand one important thing, which is indisposition. So between health and disease, so life is not just a white and black thing, that white means health, black means disease. In between that, there is a gray zone, what we consider as the indispositions. And what are the indispositions? So indispositions are seen as faults in our diet and regimen. So as simple as this, many times we do feel unwell, but that is not necessarily a disease. It is just a indisposition. There is something wrong that I have gone in my diet or regimen, what we see as a lifestyle. So simple example, suppose I had a party and in the party I ate too much and I was awake till early morning. So next day what happens? Basically I have some indigestion and I start feeling too much tired and I get a lot of body ache. Now, would I call it as a disease? And is it that necessarily I need a medicine for that? Now, as homeopaths, we know that over here we do not need any medication. So, indispositions are situations where we do not need any medications. And because they have occurred because of simple faults in our diet and regimen, I just need to correct these faults. So, what do I need to do? If I have overeaten, I just need to fast for some time, and because I was overtired, I slept late, or rather, I was awake for the whole night almost. I just need to take some rest. And if I take that rest, basically, after some time, I would be fine myself. Now, why does it occur? Because, as we know, the vital force, or we see that our body has the capability of healing ourselves. So, more often than not, we do not need medications. It's basically certain faults that have occurred in our lifestyle that we need to just correct. And often when we do that, then automatically I start getting healed. Now in yoga, these are seen as the 4 pillars of yoga management. And the first pillar, therefore, is something called as ahara, okay, or the diet. So therefore, many of our problems are related to what we eat, how we eat, and how much we eat. So this we can relate again with the Annamaya Kosha. So along with the medication, we need to take care of the ahar also. So now that's basically what is seen as a dietetics as such. But the question is therefore, are we following the proper diet or not? So when we are usually ourselves following a proper diet, then we would be able to suggest that to our patients also. So can we understand the importance of a proper diet? And therefore, this also becomes a part of the holistic healing. How we eat? Do we eat in a calm way, or are we eating hurriedly? Or in a sense, over here, what are our thought processes when we are eating? How much do we eat? So how much do we end up eating at the end of the day? Are we overeating, and after eating, do we feel quite full? We feel too much tired and groggy. It means that basically I've overeaten. But that is one advantage that when Yogesh was just mentioning about the Yoga Institute, the food is so simple that you don't overeat. And can we therefore see we often overeat because we go more for the taste rather than the nutrition. So when we go for a party, our body has the capacity to provide us all the signals. So when our stomach is getting full, we already are aware about it. But then what happens is, because we are focused more on the taste, we tend to ignore those signals. And even if we are filled up to the throat, we still keep on filling ourselves over that. And that is when we start having problems the next day. Okay. So can we just take these care also for ourselves? And when we take care of this, basically most of our problems can get resolved. So as it is said, most of the problems are related to what we eat and how much we eat. Okay, when we eat. So this is again common thing what happens nowadays. So we have a habit of just keeping some munches next to us, and while talking or just watching television, we would keep on eating. We see that the stomach is also not getting any rest. Now, as doctors, I need not go into too much details about this. Most of you are aware about it. So let's skip this. But if you can understand that ahar also becomes a part of the holistic approach. And somewhere down the line, we, first of all, ourselves need to give more importance to it in our own life. Then the second thing is what we see as achar or the routines. So routines, when we talk about our lifestyle, what is our daily discipline? What are the different things that we do in our daily routine? So are we physically active? Are we carrying out the physical exercises, or are we doing some asanas and pranayams? So are we taking care of the physical body also? Okay. Then along with that, other things like meditation or pranayams, are they being done or not? Because this also allows a proper healing for our body. Then are we following a proper timetable? Because if we know there is a body clock, and when we are following a proper timetable, the body clock is able to function in a proper way, and therefore all the juices, chemicals, etc. are released in the right way, and therefore the body can heal itself properly. Unfortunately, when we give a toss to this timetable, we become too much indisciplined with our timetables. That is one thing which causes more damage to our own body. So is it possible that we follow our routines more properly, or first of all we start creating more proper discipline life for ourselves, and that itself can also help us heal ourselves better. The next thing is what is called as vihar or recreation. Now if you see, or as doctors we are aware that maximum of our healing occurs during relaxation. So relaxation could be our sleep time or the relaxation time, but at the same time, the relaxation also comes from our ability to relax in terms of our hobbies or enjoyment. So are we enjoying our life? Are we basically involved in some kind of activities that help us relax, laughing? Okay, so in a sense, that's a good thing. We saw that even in the current Corona episode, we saw so many hilarious videos coming up. So that's a very good thing about Indians, I would say, that they see the fun part of it in every serious situations. Now, am I able to do that for myself also? So especially whenever I'm too much tensed or so, can I just go back to the previous thing like a physical activity, or can I just basically do something which is helping me relax. Uh, One common thing for hypertension, normally as a yoga teacher or a yoga student, basically they focus on the modifiable factors which are responsible for hypertension. And the common factors that we are aware about, the modifiable factors, is obesity and lack of physical activity. These do cause, or the stress also, obviously these cause hypertension. But there is one more simple thing which causes hypertension, and that is lack of good sleep. Lack of good sleep is seen to be one common factor which leads to lots of problems, including hypertension. So we have seen lots of patients who are thin, who are following all the diet properly, they're doing yoga, meditations, pranayams, they're doing the exercises regularly. They say, okay, I do not have stress. Now this is a very intangible thing, but still, in a sense, everything else they are doing properly, but in spite of that they keep on having hypertension. And then there is one question you ask them: do they snore? And very often you'll find this factor. Snoring, as you know, disturbs the quality of our sleep. And because the person has been snoring, so usually you ask the spouse, or often nowadays, in a sense, people are more open about it. So when you ask them, do you snore? Most often it would be the males. They would say, yes, yes, my wife does say that I snore a lot. Okay, so the sleep itself can be an important factor over here, which is relevant for the recreation or basically the relaxation. And it is very important for us to give importance to this factor also as a part of that holistic healing. Last but not the least, it's about the vichar or the thoughts. So ahar, achar, vihar, and lastly vichar. So vichar relates with basically our perceptions, attitudes. We can also see that our colored glasses or cognition. And as I said, as I mentioned earlier, yoga focuses very much on the thoughts rather than the other things. And therefore, if you work on the perceptions, Yogesh would certainly agree with me. He is also into holistic healing. He is also into other modalities like hypnotherapy, energy healing, etc. And when we work on the thought levels, often you find the necessity for medications coming down. Just the thought process changes and the patient starts feeling better. If there are chronic illnesses, it will take some time, but then certainly the illnesses come down. So what does it mean to work on the thoughts? So I usually do it from a perspective of what is called as chakra psychology. uh, I usually see this quite helpful. This is just like, normally there are the 7 chakras, and every chakra relates with certain thought processes or emotions, or along with those emotions there are certain sensitivities that come up. For example, suppose the Mooladhara is related with survival or security. So the person over here will be too much sensitive about survival issues or the security issues. Now, from a point of view of, suppose we say the homeopathic medicines, we find certain medicines applicable over here. For example, arsenic, which is quite restless and anxious, or aconite, which has a fear of death, or along with that, in a sense, security also means money. So all the medicines that in a sense are involved with financial insecurities, calcarea floor, bryonia, arsenic, etc. So over here we find these medicines related with this emotion. Now what I found over here was that homeopathy works at those emotions, or in a sense we can call them as the delusions also, that I am insecure, I need support, I need more money. Now, homeopathic medicines, or if we give the constitutional medicines, they are able to work on those sensitivities. The patient becomes relaxed, and once that sensitivity goes away, the patient becomes relaxed. Slowly, the disease starts resolving also. Now, as a doctor, and because I was into counseling, I could relate this with something called as psychoanalysis. So, those of you who have heard about Freud, so Freud developed the concept of psychoanalysis, where he found that most of our sensitivities have their beginning in our childhood. Certain situations that prime us or sensitize us towards certain emotions. So if you are able to understand those sensitivities through a counseling session also, you are able to work on it. So for example, if we see, again coming back to the survival or the security issues over here, these kind of people are sensitive to three issues. Okay. So one, basically survival is related to life itself. So these Mooladhara personalities, they are very much sensitive to life threats, including diseases. So whenever a particular illness comes up, they become hypochondriac. So we know the of the patients with a simple fever, they will start panicking. They will be after you, sir, can I do this test? Can I do that test? Will it be corona? Or if not a corona episode, other times, in a sense, if they get a headache, they will be after you, sir, do I need to do a CT scan? Do I need to do an MRI? Is there a tumor inside my head? They panic. So one kind of a sensitivity towards illnesses and a panic coming out of that. Secondly, security as form of security, the money issues. So these kind of people, the Mooladhar personalities, they're very much sensitive towards financial issues. So they would always want to get themselves secure with money. So as we see, either they are very much miserly, or in a sense, along with being miserly, they become anxious about everything with relation to money. So now that the corona episode is happening, and then suddenly the businesses are down, suddenly their anxieties start coming up. Or previously, whenever the demonetization occurred, there were people who started getting too much anxious. I know some of the patients who basically had to get hospitalized with panic attacks because of the demonetization. Now, if you ask them, they would say, oh, I got enough money inside my house. There is no problem. But I just don't know what is going to happen. Will it create a problem for me in the future? So we are not talking of those people who do not have money and then they're getting anxious. But we are talking of people who, in spite of having enough in the investments for themselves, but in spite of that, they keep on feeling anxious. They start panicking. And thirdly, instead of money, can we see even relations provide us securities? So the Mooladhar person is also very much insecure about relations and therefore anxious about relations. Now, can we see even medicines like pulsatilla, who basically we see very much amiable and friendly as such, trying to maintain the relations? Or in any other way, if you see, these are the people who do not want to hurt anybody, because hurting anybody, their main priority is to keep everybody happy. They are the people pleasers, because only if I'm able to please someone, I'm not hurting anybody, only then my relation is secured. And if my relation is secured, then I am secured. So their entire focus is on basically securing the relations. And the best way of doing that would be to keep everybody happy. And the common symptom, you can ask yourself also, how many of you find it difficult to say a no? These are the people who find it very difficult to say a no. Okay, because saying a no is a risk for them. If I say a no to somebody, the risk is that people will be unhappy with me. If people are unhappy with me, the relation will get soured. If the relation gets soured, they will not stand by me. And if they don't stand by me, I will be insecure. So these people, therefore, in a way, always try to keep everybody happy. And therefore, these are the most adjusting and compromising people. They will adjust everything. They're ready to help anybody. From the society's point of view, these are the nice people. And that is what actually these patients want. They want to be seen as the nice people, because only if they are being seen as the nice people, now you can take all the remedies which do this. It could be even the calcareas, who want basically the support of the people, or pulsatilla, okay, in a way lycopodium also. So in a way people pleasers, but then when I'm adjusting, what will happen? people will take advantage of me. So what will people do? Once I know your need, once I know your limitation, your weakness, that you cannot say a no to me, there would be some people around you who will start taking advantage of you. Sometimes even your own family members, especially housewives, if you see that, they will say, oh, I'm trying to tell this to my child so much, but nobody is taking the responsibility. Well, why are they not taking the responsibility? Because you are not giving your responsibilities. You are not leaving your responsibilities. Your children, your husband knows that you may keep on shouting for 10 days, you may get angry, but at the end of it, you will go and do that thing by yourself only. So why do I need to do it? So these people will have problems with people around them. They will keep on complaining. What are their sensitivities? Oh, people just take on advantage about me. Okay. But can you see they're pointing the fingers outside? So can homeopathic medicine help? Yes, certainly we are seeing them. So especially over pulsatilla, calicare, etc., I've seen it helpful, quite helpful over here. Okay. So once they do that, what happens? Slowly they start expressing themselves also. They understand that, okay, they were allowing people to take advantage of themselves. So somewhere down the line, we see some shift in their personality also. They start becoming more independent. They start understanding that, okay, I was allowing others to take advantage of me. But now, in a sense, more than homeopathy, I just handle them with counseling also. So with counseling, once they understand this, suddenly they are able to change themselves. And once they are able to change themselves, they're able to point the finger at themselves. They stop getting troubled by others. So initially it was like people are misbehaving with me. People are basically taking advantage of me. But once they become strong, once they have more faith in themselves, once they stop pleasing others, or they don't feel the need to please others, now they are able to let go their responsibilities. Once they are able to let go their responsibilities, people around them have to start taking their responsibilities. Now these people do not have any problems. Okay. So I'm not talking of any particular disease over here, because as we know in homeopathy, the disease per se is not the disease as we see in allopathy. It is not about hypertension. It is not about diabetes or piles or anything else. The disease can be anything. It could be asthma also. It could be hypertension also. It could be sometimes a headache also. Once I work on this, once I work at a thought level, then basically the patient will start working on himself. But now, as I'm just talking about it, is it possible for me to always work at a thought level? Will all my patients be ready to work directly at a thought level? That may not be necessary. So yoga gave me the benefit over here. Yoga has the benefit that yoga works on all the koshas. So those patients who are not ready for counseling, what do I do to them? I send them for the usual yoga sessions. Okay, just practice the asanas, just practice the meditation, just help them calm down. And there is another beautiful thing that during meditations, we have something called as simple instructions or affirmations. And the affirmations are beautiful sentences which you can just put it along with the meditation, and they do the job of a subtle counseling. The patient becomes aware. So for example, over here for an insecure person, a simple instruction like, okay, I have the faith that, okay, I'm secure. I'm always supported by people around me. Everything is fine with me. I can stand by myself. I can stand for myself. So these are, you can say, instructions, subtle instructions which keep on getting deeper inside the mind. And once slowly they start calming down, either in a sense the asana itself helps, or over a period of time they become ready for counseling also, or if not that, they slowly come to understand their responsibility. And if they are not ready for homeopathic medicine, they become ready for the homeopathic medicine also. So what I'm trying to say over here is holistic is not that only homeopathy is holistic or yoga is holistic. Within that also, we also need other therapies, we also need other approaches to complete whatever could be incomplete in your own therapy. It is not necessary that every time homeopathy would 100% help that patient. And then is it possible for me to be aware about other techniques which I can use as an adjunct, as an complementary part over here to prepare the patient for a better therapy, for a longer journey? So that is what I have understood about it. So now I rest my talk over here. And if there are any questions, I'll be taking that. Thank you.
Thank you, Dr. Atul. That was so nice. And Pankaj, who's taking questions?
Dr. Deepa.
There,
Yes, sir. Yes, sir.
kindly open the chat box and just check if there are any questions. You can kindly ask.
Yes, Mr. Harish Makhani has asked a question. Is 7 levels and posology in homeopathy, can it be compared? The 7 levels and posology in homeopathy.
Uh, in posology, if you understand as the potency of the dosage as such, we can see that it depends at the sensitivity of the level. So at what level is the medicine, because what I understood as the potency is the deeper the medicine relates with the patient. So if it is at a physical level, then you need to give at a lower dosage. If it is more at a mind level, the more similar it occurs, the higher would be the potency. Now, similarly over here, if you see at a physical level, yes, certainly need to keep the patient at, you need to give them more activities. But if you are going at a very uh, Vijnanamay level, the thought level, a single thought can make the person understand it. For example, Yogesh explained it very beautifully. He gave the uh, story over there. Now, he had that understanding of mauna and the inner silence. A simple exercise what was about that honking, because actually at that moment we had some other activities going on at the yoga institute also, and during that we were asked to think about the concept of mauna and different activities that can help us for mauna. And because I was driving my scooter at that time, it just struck to me that okay, why should I honk this horn? And as Yogesh has explained it in details, but for those who came in late, it was like I'm just trying to tell the world, I'm just shouting at the world, okay, do this and do that. So if I just stop doing this, what will happen? So it's kind of a mauna that I'm trying to practice for myself. So the moment I stop honking, is it that basically I will necessarily have an accident? So that was the question that came up with most of the people to whom the exercise was given. No, that's absolutely impossible. You cannot drive in Mumbai without honking. So almost 70 to 80% of the group members over there reacted to it and said, no, this is not possible. And I will not even try that, because if I try it, I'm sure I'm going to have an accident. But then why is it that Yogesh did it? Now, can you see somewhere down the line the level of your understanding? Because Yogesh was also into these kind of exercises, and he already knows that there is a training that has already occurred from him. He understands it from a deeper level. So over there, technically, I need not explain anything to Yogesh. For somebody else, I might have taken 1 hour to explain, oh, why is it helpful? How would it help you? Why it would not harm you as such? And in spite of that, again, 50% may not have done the exercise. Only 50% would have done the exercise. But why was it that for Yogesh, I just had to tell him once and he just followed it and got the experience of it? So posology, if you see, what sentence you are giving, or similarly what medication you are giving, at the same time what is the frequency of the medicine that you are giving, it depends on two things: how much simillimum the medicine is. At the same time, it depends on the sensitivity of the person also, or rather over here we can see from perspective of counseling, we can see as the understanding of the person. If the person is really understanding it, one word is enough. The other person can get the entire world out of it. Right? Okay. Thank you. Anything else?
So another, yes. participants wants to know about all the chakras. Um, you elaborated on the Muladhara chakra. There is questions to elaborate on all the chakras. They want to know more, and whether the physical ailments is related to the chakras. Like
Yeah.
someone asked whether constipation would be related to the Muladhara chakra, and
Okay.
any organs, any disease of the organ are related to the chakras.
Okay. So first of all, the chakra, it will take me more than an hour or so to
Yes,
explain that,
sir.
because I first of all need to understand or explain to you what we mean by chakras, and then what are the different emotions, and in depth what do those emotions mean. Now there are different ways in these emotions can be seen also. At the same time, there are ailments which are related with chakras, but technically I do not usually relate any particular chakra with any particular disease, because it's very surprising, you just come out with anything as such. As an example, I'll give you, there is diabetes which is usually connected with the Manipur chakra. Okay, so two or three explanations that are given over there, that okay, the Manipur chakra is present just between the rib cage and the navel area, that is the area of the pancreas also. So that is one relation which is given for it. At the same time, Manipur is also seen as a seat of power, control, etc. And if we see that with diabetes, diabetes relates with the sugar levels. And if we see, sugar is basically, the glucose is basically the currency of our body. Okay, if you see that ATP also, so most of the ATP is generated from the glucose. And therefore, when we relate with diabetes, people would usually try to relate diabetes with Manipur chakra through this philosophy. But I have experienced that it can come from any chakra. In one of my program, I saw this, that one student, she had almost 530 uncontrolled diabetes. She was taking insulin also. So in spite of taking all those things, she was not benefited. So there are three levels in of my programs. So first level is what I call as a swadhyaya, in which we just help you understand what does it mean to work on yourself. It's a foundation program. And the second level, it's a 5-week program, so 25 sessions as such, on understanding the chakras in details. Now she joined that chakra level, so she had completed the foundation program and she happened to join the level 2 of the chakra healing program. And midway between that, she mentioned to me that, sir, I'm not able to control my diabetes. I would like to come to you for homeopathic medicines. I said, anyways, don't worry about it. You are on something for the moment. Let us complete with this program. I'm sure if you get your answer, then it will get treated. Because what we do is we go one by one discussing the different chakras. So which chakra is applicable to you, I wouldn't know that. So suppose I begin with the Mooladhara. If you are not a Mooladhara personality, your answers, you will not get it. And then as I proceed from Mooladhara, and then I go on to suppose Anahat, Vishuddhi, Ajna, and lastly Brahma Sahasra. So if you are a Vishuddhi, your problem will be resolved almost in the third last chakra as such. So we'll have to wait till that discussion gets over. So I asked her to be patient. So again, in the midway, she came back to me and said, sir, still no benefit. My sugar is still high. And then when we reached Anahat chakra, she got her answer. So Anahat, suppose it is about love and compassion. And she found over there that basically she's too much compassionate. She's too much concerned about other people. But in that compassion or concern as such, she gets too much anxious about others. But what she missed out was a simple thing, that in a sense, she, when she was loving too much others, she was not loving herself. That was a simple answer that she got. Now, technically, not a, if I am just putting in a simple way, it doesn't mean anything. But for her, it was very important that she was neglecting herself. Now, the moment she got that answer, within a week, so there were almost more than 2 weeks when we started when we started with the Anahat chakra. By that time, she got her answer. And then after a week, so there was just 1.5 weeks remaining for the end of the program. She came and told me, sir, now my blood sugar is 230. So from 4 sorry, 530, it came down to 230 or 270. The important thing was I'm out of insulin. I'm not taking any insulin now. And the second important thing she mentioned was that basically now I'm not following any diet. I've stopped my exercises also. Up till now, I was too much stressed about doing this exercises, yoga also. Now I said I will just relax. I will not do any exercises. Now this is something very surprising over here. Now does therefore yoga mean, or in a sense, does it mean diabetes mean that you have to do the exercises? And do sometimes the exercise itself cause, or the need to do that exercise cause more stress in us and therefore is more harmful? We need to ask ourselves. And the moment we get relaxed inside, is it that basically that relaxation itself has a better benefit than the exercise? And by the time she finished with that, later on when she's on the level 3, by now she's completely out of medicine. She's not taking any medicines. Forget about insulin. She's not taking the other tablets or anything also. And she's still fine. Her blood sugar is just around 140 or 90 or so. Very rarely it goes about 100 or so, but she's quite well. So for me, I do not usually connect one chakra to one disease or diseases to particular chakra. As in homeopathy, every individual is, or every patient is individualist. There is an individualism over there also. So when I just form that concept over here, when a person comes up over here, that okay, and okay, diabetes, this person is Muladhar, or in a sense, this person is Manipur. Piles, sciatica, this person is Muladhar. If we have these thoughts, technically they are prejudices. And prejudices will not help you in counseling also as much as in homeopathy also. Every patient, you have to take him as a fresh case. Whenever you are taking the case, keep the knowledge of chakras aside, keep the homeopathy aside, just understand that person. That is one thing I've understood from counseling. And
What doctor?
Also.
Yeah.
Yeah.
What Dr. Atul is saying, I think I totally agree with him. I also teach chakras since last 16 years. And what he is saying is so true. You know, it's like a dictionary of dreams. You know what people say? I have dreams of water. So you just see dreams of water. But these dictionaries may not really serve the true purpose, because water to somebody means something and water to another person means something else. For a person who has fear of water, it is a sense of danger. But for somebody who loves water, it is a divine feeling to see water. So same way in chakras, as Dr. Atul rightly said, that Manipur chakra or solar chakra does not mean diabetes. The cause may be another chakra, but the expression may be at another chakra level. And that's what he was trying to say here. And somebody was asking, how do we learn chakras? It's a lifetime study. But there's a beautiful book called as The Wheels of Life. I think Dr. Pratik has also asked the name of the book. Wheels of Life by Dr. Enodia Judith. It's a huge PhD work. Please go through it. It's a fantastic book. The Wheels of Life by Dr. Enodia Judith. She came to India. She studied in Northern India and she wrote about chakras and she's selling it back to us. And it's an amazing work, amazing thesis work you can go through. And what Dr. Atul is saying here, I corroborate it because I also used to see remedies chakra-wise. 7 major chakras are there, but there are minor chakras. And what are these? These are nothing but interfaces. So what is the difference between you and your dead body? That is the prana, which Dr. Atul said. That is the life force or the vital force. Where does the vital force enter into your body? So it enters from a step down or step up transformer-like interface or vortices in the body, just like the sponge has those holes from where the water goes inside. So the water is inside as well as outside, and the sponge is floating in the water. Same way, we are energy sponges. We are floating in the energetic universe. So there is vital force inside us. There is vital force around us. We are part of a larger vital force and the universe, what Dr. Atul was saying. So like that, every cell needs energy and every cell has a chakra. Those are the minor chakras, and each chakra is ruled by one emotion. What we have studied in Patanjali Sutra, what Dr. Atul was saying, is the 7 major chakras. They are the 7 major intersections of the highway. But then there are by-lanes. So if the major traffic sections are taken care of, then there is no traffic jam in the by-lanes.
True.
And that's how we work on the chakras. And what Dr. Atul is saying, it takes him 5 weeks in his Swadhyaya course to understand. And all answers have to be found by yourself here. And that's why the importance on diet, regimen, indisposition, what he has connected to in homeopathy, we hardly Very few people give it so much importance. You saw so many people must have thought, oh, this is diet and regimen, I already know it. How much importance do we give it? How often are we taught about dietetics in our college? Hardly. We are not even talked about. We are not talked about lifestyle. They just say have a healthy lifestyle. Doctor tells you don't take stress. Has any patient ever asked you, doctor, tell me how to not take stress? You come and live in my situation in my house and then tell me I should not take stress. How do I do it in spite of my stresses and the maintaining causes around me? How do I not take stress? Can you please tell me? That led me into this journey, and I'm sure to Dr. Atul also, where we went beyond medicine, where he's telling you to incorporate all pathies and this as well, because the higher purpose of existence is to go even beyond homeopathy. And that is true health, what he was talking at the 4 levels. So, sorry, Atul, I just got very
no,
charged
it's okay.
to say
Absolutely
something.
fine.
Thank you so much.
Very true. Yeah, thank you. Yeah. Okay, so one or two questions that came up. One was, the stepwise, if you can just break it. What I found was something related in counseling. There are 3 steps in counseling. If you want to counsel or take a homeopathic case, there are 3 steps. First is what is called as exploration. Okay, it's the EUA process. So E stands for exploration. First of all, you have to explore. The second is understand. Okay, and the third is basically action. So action means what needs to be done. Now that is what happens. Normally what we do is whenever somebody asks us, sir, I've got constipation, what do? I immediately come to a conclusion, do this, ask and take this medicine. Okay. Now, therefore, sometimes it helps, sometimes it does not help. Or suppose somebody comes with a problem, sir, I get angry a lot, I get anxious. What do? What do I say? Okay, immediately do this asana, do this pranayama. Now, have I understood the person first? Have I understood that case? So the first thing is always exploration. Exploration, as we understand, is the case taking. So am I taking the case properly? Am I listening to the person or not? Am I coming to an understanding, or are my prejudices coming in my way of my understanding? So we usually find over here that my prejudices, my previous knowledge, this chakra is this problem, or this problem is this chakra, or this problem is this medicine. So whatever you have learned from the various doctors or the sessions over here, somewhere down the line, it may be at the back of my mind also, but that may stop me from exploring further and understanding the patient closely. And often, therefore, the problem is not in homeopathy or whichever field we are using. The problem is in ourselves, where we are not listening and understanding the person. One common thing, why are we not understanding? Because usually the moment somebody asks something, we stop them and we start giving the advices. Do this. So, okay, so just 3 things: exploration, understanding, and then lastly the action. So in homeopathy, I would say the action would be finding out that medicine. Finding out the medicine is the last thing. 90% or 99% are the first 2 steps: exploration and understanding. If I do that well, the last step will be easy for us. Yeah. Okay, so somebody was asking the name of that book. So one book which Dr. Yogesh mentioned, Anodi Judith. Somebody has already typed the name.
I have written it on the group chat. I have written the
Yeah.
details. It's easily available.
Another name is basically Maheshwaranand, Swami Maheshwarananda also. He talks on a different perspective. Now the only thing is basically these books talk from a perspective of spirituality. So you can see only from a perspective of spirituality how these different things occur as such. I have also written a book what is called as Integral Chakra Psychology. That book is basically talking from a psychological perspective. So even spirituality becomes one aspect of it. It is not considered as the highest thing. It depends on you, because according to me, there cannot be any hierarchy. Normally in chakra psychology, there is a hierarchy which is given, which is the Mooladhara is the lowest one and the Brahma Sahasrara is the highest one. And we are all supposed to come out of our Mooladhara and pass on to the Brahma Sahasrara. Now, if this were true, if there was a hierarchy, then basically all of us would have followed it and none of us would have a problem. The fact is, there is no hierarchy. We have our own individual hierarchies. Okay, so we have our own priorities, like every simillimum or every homeopathic medicine, each are different personalities. Similarly, we are all different personalities, and my problems come from my individual perception about life. So the 7 chakras, I tend to see them as basically windows. These are the windows through which we see our life, and whatever window I'm seeing through, that is the world for me. So for example, the anath person, the world for them is basically love and compassion. So either they want love or they want to give love. And the entire world relates around this. And if there is some imbalance, then they have a problem regarding this. So for a person having a problem with love, you tell them, no, 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 you have to search a job first. Forget about love. It will not work for them. You will have to work from their window. And you will have to give them the answers from that window. Or for everybody, you cannot say, no, come out of your Mooladhara and reach the higher reality. No, you cannot give this to everybody. Spirituality is not for everybody, or it may be for everybody, but everybody is not ready for that. Or the meaning of spirituality is different for everyone. Does it mean to say that survival does not have an aspect of spirituality? If everything was about liberation, then why was creation created? Why were we bonded then? So we need to understand that every window has its own importance. So in counseling, we have to see the world from that window. So we have to explore and understand what is the window through which the person is seeing the world. And through that window, why he or she is having the problems. And then that needs to be worked upon. So as of now, I'm just mentioning this much. If I want to go into details, as I said, it will take more than an hour or so. So some other time, if possible, we can have another session on that. Okay, so if anybody has any questions regarding today, first of all.
We have time, Dr.
Anyone has any questions, please raise your hands. John, sir, you were saying something?
Do you have a lot of time now for 8 o'clock? What's the time remaining?
10 minutes. Yeah,
10 minutes, sir. 9 minutes.
Have any 1 or 2 questions you can take in?
I think
Yes,
Poonam
Dr.
has raised her hand since a long time. Poonam, iPad, and Kaushik, Dr. Kaushik.
Okay, I'll take Dr. Kaushik has put his hand down. Dr. Ekta. Okay,
Dr. Ekta,
please
you can-
unmute yourself.
Yes.
Dr. Ekta. Dr. Kaushik, you can go ahead.
Hello, sir.
Hello.
Namaskar, sir.
Namaste.
This is aura. Inside the crystal, we find aura. What about the experience of the aura and carillon photography of the person? Please elaborate.
Okay, so aura, yes, certainly in a sense, when you talk about energy fields, that energy field is experienced as an aura around us. It is certainly present. Now, it can be seen through personal experience also, or it can be, nowadays we have other Kirlian photography or other devices to help us see that also. So certainly one aspect, but frankly speaking, I do not deal too much with that. So I will not like to comment anything further on that.
Atul, can I say this? Reply to this?
There was another
Yeah.
question. Okay, 1 minute. Okay, fine.
No, regarding aura, so you're talking about, so there is Kirlian photography, which is now superseded by biofeedback photography. It's available everywhere. Many people have it. It's software based. And now you can literally get your aura chakras get photographed in real time, as Dr. Kaushik, you have been asking. So it's easily available. You can just contact us later on. I'll give you all the details for it, what you want. Earlier I used to do it. I've stopped doing it now. Yeah, Dr. Atul, you can take the question.
Okay, so for the moment, I do not focus more on the energy. I focus more on the emotions, on the thought level. Because from a perspective of yoga, the Buddhimay or the Vijnanmay kosha is the most deepest one. Okay, so one way of working on the energy fields is through working on the energy healing or aura healing as such. But if I've not worked on the thought level, then that energy will keep on getting disturbed again and again. So the deepest level of working on the energy is always on the thought level. So frankly speaking, I do not focus at all on the energy. I focus just on the thoughts. If the thoughts are changed, the chakras will automatically get balanced. Frankly speaking, I do not have to bother about the chakra. I have to just understand where the thought process is wrong. I have to just correct that. Whichever chakra was imbalanced, it will automatically get corrected. The energy will automatically get corrected.
Absolutely, very true. And that's why I left aura photography many years back, because it changes with emotion. Then we have so many emotions. In 1 minute, we have how many emotions? In fact, there was Dr. Prakash Vakil. I used to sit with him. He used to he used to do Kalyan photography and homeopathy. So he would keep the hand of the patient in the OPD. He would click the
Government
pictures
OPD?
and
Government
OPD.
OPD,
Correct. In the government
yeah,
OPD. And with the pictures, he would then come to the remedy. And then he found out the different colors and its associations with homeopathic remedies. And it was very accurate, because I would take the case later on trying to prove sir wrong, but it always came correct. Yeah. And then he told me that you will not understand my style, because that time I was very worried about prescribing the remedies and coming to similimum. I did not understand the higher aspect where he was working. So he just gave me a chart of colors. Yeah, and he told me in the ward. You remember, right?
We used
so he
to have
gave
a
the
lot of
chart
problems with
and
them.
just prescribe, ask them the color, prescribe in the ward. That's it.
We used to have a lot of problems with this functioning. In a sense, he would just say, no, give this medicine. I used to keep on questioning, sir, what about all his symptoms? He said, nothing, give him this medicine. And it's to work. Certainly. Okay, there was one more question asked by someone about thyroid. Yes, thyroid also, we have treated lots of patients through homeopathy and counseling for hypothyroidism. Okay, so certainly, in a sense, over a period of time, the medicines have also been stopped.
Dr. Ekta, you would like to ask a question?
Yeah, I have a question. Am I audible?
Yes.
Yeah, sir, good evening. Yeah, sir. Sir, I was just going through the books by you, just understanding the concept. One thing I want to ask you, in case we have talked about the spirituality while counseling and while, before talking to a person or a patient and understanding the thoughts and all those things. So the philosophy of yoga, when we talk about philosophy of yoga, so how can we use this philosophy, what we have learned and what the concept we have learned while counseling a patient or while making him understand the concept? What is the right way to present the philosophical part about the philosophical part
of yoga?
Right.
Okay. Now, if you see, basically, yoga talks about focus.
Right, sir.
Okay, so simple thing, yoga would give practices as to how to reach that focus.
Right.
Okay. Now, there are simple practices, so meditation, etc., for you to reach that state of focus. Now, can you see, first of all, the Yoga Sutras were written at a time where yoga practice was done frequently by a certain group of people, etc. But now today, yoga has to be reintroduced. So we are at a totally different level where I have to again explain what is yoga.
Right.
And then, because of different kind of stress or the external influences, can we see that our mind is disturbed? So there are two things. First of all, when we talk in terms of yoga principles, yoga chitta vritti nirodha, stopping the modification of the mind. So whatever you do, if you are able to do that, matter ends over there. Now the question is, if you are not able to do that, so how many people, in a sense, suppose there are 100 people joining a yoga program, maybe 50-60% of them, they are able to just do those practices, understand what is being said, and then they are able to get that state of focus or calmness within them. Now for the rest, maybe 40-50% people, in spite of doing those practices, they're still not able to reach that state of calmness or focus. And then the reason would be there are some internal thoughts which are not allowing them to focus. Okay. Now what do I do with these thoughts? So again, there is a lot of philosophy of yoga. You try to understand that. So there are parikarmas, pratipaksha bhavana, so many things which are mentioned.
Yes, sir.
So if you are able to follow that, if it helps you, good. But then maybe by the end of it, maybe still there are 20-30% of patients which are remaining, students which are remaining, who in spite of doing all those things, still are not able to get that sense of calmness. Now here comes the importance of counseling or swadhyay.
Perfect.
So by doing that swadhyay, can I find out those emotions or those thoughts which are not allowing me to get focused, or therefore which are distracting me?
Right.
So once I'm able to do that kind of a swadhyay, it helps me to identify those thoughts, eliminate them. So once those distracting thoughts are removed, my negative emotions are removed, automatically
Right.
I am able to get focused. So can we
Focus,
see
right.
all these techniques, whether it is yoga, whether it is EFT, NLP or anything, these are techniques for us to work on our emotions, get away with our distractions, and then finally the intention is get focused on whatever your purpose of life is. That is your
Right.
yoga.
Perfect, sir. Wonderful. Thank you so much, sir.
Thank you for the question, Ekta.
Thank
Have
Dr.
you
Deepa?
finished all the questions?
Yes,
Hello,
sir.
So, any book to learn koshas is one of the
Koshas,
questions.
I'm not sure. I will just find it out and just post it to Dr. Yogesh, then he can forward it on the group maybe.
Sure, sir.
Thank you. Yeah, thank you so
Any other questions?
much. Yeah, we have one
Poonam?
announcement to make. Dr.
Yeah. Hello, sir.
Yeah.
Yeah, sir, I have a one question on the base of security. As you mentioned in Muladhara, so those patients are explaining about the insecurity wise, they have insecurity. So many times I noticed they mention that sentence is acceptance as well. I'm not accepted with the family and like that. So that one is related with, as you mentioned, is in this one is Shuddhi. So these also can be relate, mean,
Yes. Exactly. So technically speaking, the Muladhara is never the problem. Insecurity is not the problem.
yeah.
Actually speaking, let us think of it the other way around. What kind of a person feels secure?
Yeah,
And the answer is usually a person who has faith.
yeah,
Okay, so faith is basically two chakras: faith in myself, that is Vishuddhi,
yeah.
and faith in the higher reality, which is Brahma Sahasrara Chakra. So when you have
Okay,
to work on the Mooladhara Chakra, you are not actually supposed to work on the Mooladhara Chakra. You are supposed to find out the faith of that person in himself. And usually, therefore, we find basically the person either has low confidence,
yeah,
or basically there is low confidence in the sense uh, society also has an importance over here. So somewhere
exactly.
down the line, let us understand now what do we mean by higher reality. Over here, I understand higher reality not only as the spiritual higher reality.
Mm-hmm.
Anything that is above us is our higher reality. So even our government system is a higher reality for us. And the functioning of the government also contributes towards feelings of either security or insecurity. And somewhere down the line, it is the necessity of the higher reality also, the responsibility of the higher reality also, to create a sense of security in the people down. So in the present corona episode, if you see, when the governance falls or it falls down, the governance is not occurring properly in this present episode of corona. See how people panic.
Yeah,
Okay,
yeah.
so it is not always about me, it is me about me also. That is one thing that I need to work upon. But then that option we leave it to the counselee, whether you want to work on the faith in a higher reality or a faith in yourself.
Oh,
90% it goes to faith in myself.
all right.
And
Okay.
once that is done, when the people develop that faith in themselves, the feeling of insecurity is always reduced.
All right.
Good
Oh,
observation, Poonam.
Yeah.
okay. Thank you, sir.
Thank you so much, Dr. Atul Pednekar. It was really wonderful. I think one session will not be adequate enough. I think this is just the entry. I think it will be just a trailer. Abhi to picture baki hai. Okay.
Thank you, sir.
And
Thank you, sir.
reminding each of them, today was a very nice, very reflective session on the holistic approach. And it always tells us that we come as one. We live in this life as one. We fall sick as one. And we always heal also as one. So this holism is very important. Do not break a human being because human is always, the mind, body, soul is always one. So even I had one presentation, and Dr. Yogesh will remember, I spoke about the knowledge of the mind, knowledge of the body, and knowledge of the soul.
Yes.
And that trinity of life continues. And it is each one's understanding. I being a marathon runner,